Hello, my name is Amir. I'm pleased to say that I'm a dental surgeon and I'm here to talk to you, a budding dental or a medical student, a GP or a GDP, or anyone for that matter, about a Streptococcus tonsillitis and a Streptococcus sore throat. And so the next important infection causing tonsillar involvement in the mouth is not a virus, is a bacteria, is a Streptococcus tonsillitis, and is the main cause of outbreaks of sore throat in institutions like schools, hospitals, army barracks. And people will just go down with a sore throat, a very severe sore throat. And you can say that patients are febrile, they feel unwell, they have chills, and they have a very severe sore throat. And that is caused by the beta Haemolytic Streptococcus of Lancefield group A. And if you look inside the mouth would generally be red and inflamed. And if you looked at the tonsils, you will see that there are little beads of pus, little spots on the tonsillar pits. And on the tonsils themselves, there would be enlargement of the draining lymph nodes around the tonsils. And in the neck, there would be enlargement of the jugular lymph glands. There would be lymphadenopathy, enlargement of the draining lymph nodes. And because this is a bacterial infection and not a viral one, the white blood count would be raised, and indeed there is. And a blood count of 11 to 15,000 with 80% polymorph leucocytes, neutrophils, would be in favor of a bacterial infection, and a streptococcus won't come to that. Now, this disease also has some complications that I think you should know something about, and the first thing is called a quinsy. Quinsy is just an infection around the tonsils, and it's very uncomfortable and it's very unpleasant. And if it's bilateral, of course, it's not only uncomfortable and unpleasant, it's very dangerous because of the respiratory pharyngeal obstruction. Secondly, this is the same bacteria that produces a toxin in some cases, and that toxin affects small blood vessels and produces an illness and a generalized skin rash and a sore throat that we all know as scarlet fever. So scarlet fever is produced from a toxin from the beta Haemolytic Streptococcus of Lancefield group A, and people will go down with a sore throat and a streptococcal infection causing scarlet fever. How do you make a diagnosis? Well, you look inside the mouth and you make a clinical diagnosis, and from what I've said to you, it's sometimes difficult to know whether you're dealing with a viral pharyngitis, or whether you're dealing with a streptococcus tonsillitis, or whether you're dealing with glandular fever, or whether you're dealing with an acute specific fever. But if you looked inside the mouth and you saw little beads of pus on the tonsils, it would be much in favor of a bacterial tonsillitis and a bacterial infection. And in that case, you would take a swab or a throat washing and to see whether you can culture it. And you can also do a blood test. You can measure the Anti Streptococcus Lysin Theta in the blood. And in patients with a Streptococcus tonsillitis, that would be raised. How do we treat it? Well, that's easy. We give them penicillin and it goes away. Quinsies may need surgical drainage, and respiratory obstruction may even need tracheostomy in some cases. Now, the importance of a Streptococcus tonsillitis is twofold. There are two diseases that follow it. Both of them are of great importance to dentists, great fascination to dentists. Well, at least one of them is, and that is called acute rheumatic fever. I'm sure you've all heard of that. Acute rheumatic fever is a disease where there is fever and rheumatism, fever and joint pains, if you like. And it's classical that it comes on 2 to 3 weeks after a Streptococcus tonsillitis. So that's where the connection is. So if someone has had a Streptococcus tonsillitis, they may go down with acute rheumatic fever 2 to 3 weeks after it. Some of them may get Chorea. I'm sure you've heard of that. That is just another manifestation of acute rheumatism, but instead of having joint pains and fever, they have involuntary movements. They're going like this all the time. The mother wonders why they cannot sit still. But that is just another manifestation of rheumatism and joint pains as fever would be. But it's a bit more harder to diagnose, I suppose. The second thing what would get is again 2 to 3 weeks after a streptococcus tonsillitis, they go down with acute glomerulonephritis, inflammation of the kidneys, both kidneys, in which they pass blood or smoky urine, they develop a high blood pressure, they develop fluid retention and edema, particularly around the face, and both these disorders are immunological. That is, if you were to culture the heart, or the kidneys, or the joints, or the brain, you will not find streptococcus there. And probably what happens is that when this streptococcus invades the body, it produces an antibody to it. And because the streptococcus shares the same antigen with the heart and the kidney, an immune reaction is set up, and damage is mediated by antibodies and by lymphocytes. But you will not find streptococcus there. You cannot culture it in the brain or the kidneys.